Ginger, the knobbly root that's rooted in history as both spice and medicine, has enjoyed a resurgence in popularity over the past few years. With a reputation for soothing upset stomachs and lending zing to a variety of culinary delights, ginger is championed by health enthusiasts and nutritionists worldwide. But as with any powerful ingredient, ginger is not a one-size-fits-all solution. There are scenarios where its consumption can be risky, if not detrimental, to certain groups of people. In this video, we'll explore the under-discussed aspect of ginger's consumption when it should not be consumed. If you or your clients are suffering from particular conditions, you might want to reconsider over-enthusiastic consumption of ginger. Our aim is not to malign the root, but to unfold the nuanced reality of its health impacts in various circumstances. Before we dig into the nitty-gritty of when ginger can lead to complications, it's imperative to grasp the underlying chemistry. Ginger is rich in bioactive compounds, notably gingerol, shogal, and paradol, which give it its characteristic pungency and medicinal properties. These compounds are believed to be the source of ginger's anti-inflammatory, antioxidant, and therapeutic effects. However, they can also elicit strong reactions in certain individuals. Ginger's diverse range of pharmacological activities makes it an intriguing player in the health arena. But as with all bioactives, the dose and the individual's underlying health play pivotal roles in determining its safety and efficacy. Ginger and gallbladder diseases, a troublesome duo. The gallbladder plays a crucial role in the digestion process by storing the bile produced by the liver. This handy pouch can run into trouble, and when it does, ginger might not be the friend you once thought it was. People suffering from gallstones or other gallbladder diseases are often advised to steer clear of ginger and other potent spices. Why? Because ginger's ability to stimulate the production of bile can be a double-edged sword for those with gallbladder issues. While in some cases, ginger's bile-promoting effect can be helpful, such as in addressing sluggish digestion, in people with gallstones, this could lead to painful gallbladder spasms and exacerbate the condition, sometimes necessitating the removal of the gallbladder. Heart conditions and ginger, an unpredictable mix. The heart is one of the most vital organs in the human body, and its health should not be taken lightly. For individuals with certain heart conditions, ginger can pose risks. Ginger has been found to lower blood pressure and cholesterol, which could be beneficial for heart health in moderation. However, these same properties can be dangerous for people already on blood pressure or blood-thinning medications. Taking ginger alongside these drugs can lead to an unsafe drop in blood pressure or excessive thinning of the blood, increasing the risk of bleeding. This underscores the importance of consulting with a healthcare provider before adding ginger or any other supplements to a daily regimen, especially for those with heart conditions. Ginger and diabetes, monitoring is vital. With the prevalence of diabetes on the rise, it's vital to understand the interactions between ginger and glucose regulation. Research suggests that ginger may have beneficial effects on glucose control, insulin sensitivity, and some diabetes-related markers. However, these findings are preliminary, and the data is not robust enough to recommend ginger as a treatment or management strategy for diabetes. For individuals managing their blood sugar levels closely, consuming ginger may affect their medication's efficacy. Ginger can lower blood sugar levels, so those taking diabetes medication should be cautious and monitor their levels closely when using ginger as part of their diet or supplement regimen. Pregnancy and ginger, a delicate balance. Pregnancy is a time of great change in a woman's body, and the safety of many foods and supplements is called into question. Ginger is often recommended to alleviate morning sickness and nausea during pregnancy, and studies have indicated it can be effective with no increased risk of major malformations. However, the American Pregnancy Association suggests pregnant women should limit their ginger intake to no more than 1 gram per day. Excessive consumption of ginger during pregnancy may lead to unwanted side effects, including heartburn. In rare instances, it may also contribute to bleeding and low birth weight. Pregnant women are advised to consult with their obstetrician before incorporating ginger in any form into their routine. The interaction with medications. Ginger's pharmacological activity extends to its capability to interact with medications. The root can affect how the body processes certain drugs, including anticoagulants, blood pressure medications, and diabetes drugs, potentially lessening their effectiveness or increasing the risk of side effects. These interactions are known as food-drug interactions and are particularly pertinent to those on multiple medications. If you're on prescribed medication and wish to incorporate ginger into your diet or supplement regimen, it's essential to inform your healthcare provider to avoid unforeseen complications. Ginger and blood disorders, a potential for bleeding. Blood disorders, including hemophilia, thrombocytopenia, and others, indicate a compromised blood clotting mechanism. For those with these conditions, ginger's ability to inhibit platelet aggregation can exacerbate the problem, leading to increased bleeding and difficulty clotting. The antiplatelet effects of ginger, similar to that of aspirin, are concerning when combined with these types of conditions, making ginger-rich foods or supplements risky for those with blood disorders or anyone prone to bleeding. Although uncommon, allergic reactions to ginger are reported. These reactions can range from mild skin irritation to more severe anaphylaxis. People with known sensitivities to ginger should avoid any exposure to the root, whether it be in food, drink, or supplement form. Cross-reactivity with other plants in the Zingiberaceae family, such as turmeric, cardamom, or galangal, is also possible. The symptoms of ginger allergy can include oral itching, hives, abdominal pain, and difficulty breathing. If you suspect an allergy, seek medical attention immediately. Ginger is a fascinating root with a storied past in traditional medicine and a promising future in scientific research. Its bioactive compounds grant it a versatile profile, offering various benefits to different individuals. However, ginger's potential to react with specific conditions or medications should not be overlooked. For those with underlying health conditions, especially those mentioned in this article, discretion is advised when consuming ginger. It is always wise to consult a healthcare professional before making any significant dietary changes, especially when health is at stake. Ginger may provide a punch of flavor and health benefits to many, but for others, it's a careful balancing act. Like with any powerful substance, moderation, education, and communication with health professionals are key. Understanding the individual nuances of ginger consumption is not about painting it as a villain, but rather as a complex character in the story of personal health. The decisions we make about what we put into our bodies are significant, and they should be made with all available information at hand.